The Unconventional Therapist Guide to Nothing.
Hey everybody, welcome to The Unconventional Therapist. I'm your host, Dave, and joined here is my co-host, Jeff. Greg.
You can call me Jeff all day. I don't know what that's about.
All day long.
Is that my replacement?
I guess. It's your doppelganger.
Yeah.
He has a goatee but no mustache.
Interesting. Or
the opposite of you.
The beard and no mustache is the opposite, because that's a hard choice. It's an Amish choice, but it's not a good
beard with no mustache. Yeah,
I don't like it.
I think I might have tried that once.
Really?
When I was young, I didn't.
In Lancaster, Ohio?
No, I think when in high school, I might have shaved the mustache and left the beard.
Okay.
Maybe it was elementary school.
Hey, we all go through crazy phases, right? You went through that was your Rumspringa.
Yeah, that was my Rumspringa.
For those who don't know.
No one's ever confused me with an Amish person. Right? Actually, one time I put a hat on. I look kind of Amish.
Look, I mean, it's not a terrible look. It really isn't.
It's a choice.
It is.
And at least you have a choice, right? Greg, how has things been this week for you?
Dave, I've been really busy, and we've just been talking about it a little bit, and maybe we should share with the listeners, if if you're too busy and you're feeling a little overwhelmed and like you're just doing too much, burning the candle at both ends, as they say, maybe time to take a little break, take care of yourself. That's what kind of the path I'm on right now.
You gotta set some boundaries for yourself. Try to rein it in a little bit when things get out of control.
You really do. Take care of number one.
Greg, I really thought that maybe I'd see you more relaxed and well rested today. I was a little taken back when we were touching base and we're both kind of recognizing feeling a little burnout recently. But I thought you were going to be well rested because you had celebrated 420 this weekend.
Oh my God. Yeah. Well,
right.
It's interesting. We have not done a marijuana episode, and I wonder what that would be like.
Yeah.
Now that is one of the episodes. So we've gotten a complaint in the past where, what are you guys doing talking about mushrooms when you're not really doing mushrooms? I think that we could get together, smoke a little pot, even though we both, I don't know how often.
That's legal where we are, just so everyone's aware.
Excuse me. But it's doable. It's doable, right? Yeah. And then kind of share our experience. I wonder what
I would feel so incredibly guilty doing an episode of this under the influence.
Okay.
How do I know I'm in control of my words?
Right. Well, we can listen to it after when we're not under the influence. And
it wasn't me. It was the marijuana.
It might be majestic. It might be great. It might be the best we've ever done.
It actually might not be any different than what we already sound like, because no matter what, we sound like we're under the influence.
That's true. And in the early episodes,
bunch of nonsense.
We were under the influence of a couple of beers to like calm the nerves, right?
Yeah, you were a nervy guy. I was steady and solid and.
Mm-hmm. And you are right now.
I was nervous too.
I'm still nerved up. Dave, can I get into it? A little bit?
Sure.
All right. I find this interesting because we're going to talk about a disorder, which we've often done, but we're going to talk about it in a different way. We usually talk about, say you have depression, you have diabetes, anxiety, whatever it is. We talk about trying to remove the disorder from the person. But what if the person in the disorder are so interconnected that I don't even feel right calling it a disorder? It makes you. It's as integrated as your personality. Could you take a guess at, well, you could definitely take a guess. You are aware of what the
type 2 diabetes.
Yeah. Which is a serious illness in and of itself. But no, Dave, we're talking about something that, I suppose, not just because of the work we're in, but I think something more prevalent than ever.
Today, Junior.
Wow.
That's
all right, Dave. We're talking about autism. Autism, ASD, autism spectrum disorder.
I apologize for getting a little impatient, but yes,
okay.
That's the topic of the day.
The overviews, Dave. I don't know if over 100 episodes in, you haven't gotten used to the fact that they're wordy, and you have to allow me that. That's all I ask for.
I feel like sometimes I do okay.
Yeah, you do. No, I see you over there squirming.
Like, come on, just say it.
Yeah, like I almost try to like sneak it in. Like I lead into what we're talking about. But people, when they click on it, they already know what it's about.
I
So
know.
it is kind of counterproductive, but it's fun.
You like writing them, I feel like.
I do. So, Dave, I'm going to get into what it is.
What it is. Greg, tell them what it is.
Next time we're both feeling burnout, we skip that week. All right. That might be a plan for the future. So what it is it's a developmental disorder, and I don't want to suggest that somebody with autism isn't developing correctly. It's just differently, right? So it's definitely not bad, and I'm doing little quote things here. It affects social interaction and communication, but can also have these repetitive patterns of behavior. We're going to talk about a wide range of symptoms because it is a spectrum, right? And I'm going to leave the symptomology up to you. But, the spectrum itself kind of refers to this wide range of symptoms and severity from, not barely noticeable all the way to, very severe nonverbal difficult cases, right?
Yes.
Okay. So ASD, and you wanted me to get into this a little bit, and I'll get into it a little bit more after, but it includes Asperger's now. And it includes childhood disintegrative disorder and other sort of non-specific developmental disorders. It's just lumped in all these developmental disorders. And I think at the end, it's going to be important to talk about our thoughts on this, like having this huge wide range of symptoms under one disorder. And I think maybe we could even talk about concept creep a little bit, maybe in the end.
Sure.
Okay.
Are you planning on explaining why they're all lumped in, or do you want to wait?
I will explain why. Unless you want to kind of do it now.
We can wait.
Okay. So this is the kind of thing that begins in childhood and eventually will cause difficulties. You'll notice it as early as 18 to 24 months, but it's going to cause difficulty in school, social situations, playing with other kids, just integrating in society in general. But by the time you're 2 years old, it's usually pretty visible. Would you agree with that?
Yes, that's what they tell us.
That's what they say. So there's no cure, which again is kind of uncomfortable for me because that suggests that people who are different need to be cured. But for the sake of what we're talking about here, there's no cure. And
I think when they say that, it's just to differentiate it from other, disorders that we would read about in the diagnostic manual, right? So it's just kind of letting people know. But you're right. I think it's also important to clarify that we're not viewing this as something that you would need to be cured from. It's it's a way of existing, right? It's a way of being.
Right. So almost the same way I would think of anxiety. It's like I'm never really trying to cure anxiety. I'm trying to change your relationship with anxiety and find out what's useful about it and how do you integrate it into your life, right? So
we're never going to stop having anxiety.
No. Or else, dude, or your life would suck.
Yeah.
You wouldn't.
And if you don't understand what we're saying, please do go back to our Guide to Anxiety episode from months ago. But what Greg's alluding to is years ago now. Wow.
Yeah.
Dang. We all have anxiety to some, just in varying levels. So anxiety is always going to exist. The same way for individuals who have autism, it's always going to exist to varying levels.
Right. So if I didn't have anxiety about, maybe writing a podcast on autism, then we wouldn't even be able to have a podcast about autism. It motivated us to get it right, Mm-hmm. So with autism, back to autism, early intervention is going to be key. So parents who understand the disorder is going to be key, and completely understanding the disorder as a parent, it's going to still be hard and great, right? I mean, we talk to a lot of parents that have autistic children, and it's a great experience, but it's very hard. And we'll get into a lot of those reasons why, and we'll talk about some of our experiences with parents and children who do have autism. Yeah. So causes. For some, it can be associated with Rett syndrome or Fragile X syndrome, and we don't need to get into that's just in a different way to say it can be genetic, right? So different types of genetic mutations, which again, not a great word, but that's what's going on. It can be environmental. Scientists are trying to understand if it could be complications during pregnancy, air pollutants. I'm sure you've heard this, Dave. Have you ever heard people talk about that they think vaccines could play a role?
Yeah.
Yeah. So most of the research says no, but I guess there's some anecdotal evidence that says yes. So we're not really going to take a stance.
There's a 1,000 like hypothetical or, people making guesses or, trying to draw conclusions to things they think contribute to it. I don't think that any of those things have, specific validity. It's just people's beliefs at this point.
This show is sponsored by BetterHelp. We're all spread pretty thin, and it can be easy to ignore our own needs. We can get caught up in life, concerning ourselves with social life, stress, work. It can be easy to start to neglect ourselves, feeling lost, drained, or overwhelmed.
You're absolutely right, Greg. Therapy can help by providing us the tools you need to improve your mood and understand you can't help others without helping yourself. One of the things that has prevented people from the help they need is accessibility, whether it's transportation, time, getting an appointment in a timely manner, or even issues that prevent you from leaving the house.
And therapy, being even more accessible, is where BetterHelp comes in.
BetterHelp is entirely online, convenient, and flexible.
But Dave, here's something I'm worried about. What if we get matched with a therapist and it just really isn't a good fit?
Well, Greg, that's one of the best features of BetterHelp. If for whatever reason the therapist isn't a fit, you can switch therapists completely free.
And that's going to save you any awkwardness, hard feelings, and just avoiding that tough conversation. Find your social sweet spot with BetterHelp. Visit betterhelp.com/nothing today to get 10% off your first month.
That's BetterHelp, HELP.com/nothing, NOTHING, for 10% off your first month.
Dave and I believe very deeply in therapy.
So much so, we've devoted our entire lives to it.
So go to betterhelp.com/nothing.
And get that BetterHelp you need today.
Yeah, I mean, although disagreeing as we often do, I think, is it possible? Sure. But okay, that said, I mean, do I think that you should not get your children vaccinated because of that? Absolutely not.
And that's where that conversation becomes dangerous, because
that's why I kind of caught myself there.
Yeah, if we put validity to things that don't have actual backing, then we do cause frames of mind that start to question everything, right?
You see how I mopped that up. So let's talk about some risk.
I have a couple of other factors that could be, from what I understand, could increase a likelihood of an individual developing ASD.
Yeah, so do I.
Having a sibling.
Yep. Being a boy. Boys are 4 times more likely to have autism. I
question whether that's 4 times more likely to have it, or is that a diagnosing issue? Because it is more commonly noticed in boys because of behavioral reasons,
right?
Yes,
yeah,
correct.
The way it comes out, sure.
Having older parents is a risk factor. Very low birth weight is another risk factor.
Yep, or premature too. Mm-hmm. So here's the thing with the age thing. So you're seeing more. Maybe you're seeing more autism, right? That's what, or maybe the definition is just broadened so widely that more people are fitting into the autism spectrum.
It's another one of those things. It just depends who you're asked, right?
But part of it could be, there is this correlation with older parents, which you're seeing a lot more of, right? Yep. There's not a ton of research on this yet, but there is a lot of evidence that suggests that older parents have a significantly higher probability of having children with ASD. So messing with nature, Dave. I mean, at a certain point,
messing with nature.
Well, listen, at a certain point,
my parents are going to come over and beat you up, Greg.
But did your parents have, what I'm saying is, with the advent of Viagra and all these things, maybe, your bits are supposed to stop working at a certain age for a reason.
All these older parents are hopped up on Viagras?
Well, yeah.
There's a lot of assumptions being made right here, Greg.
Well, listen,
I think I know who's on Viagra, who's not. That's all I'm saying.
Not yet, but I mean, you know, should there ever be a time where I need it, I will not be ashamed, right? Sometimes medication is necessary. Anyways, Dave, let's get into some signs and symptoms here. Let me pass the torch on to you a little bit.
I just really hope like the big takeaway here is that you didn't just shame a bunch of older parents. Just because you popped out 7 babies when you were 17 doesn't mean there's anything wrong with waiting a little while, Greg.
Well, honestly, I had one at what, 39. So that's really walking the
Look
line.
at you.
That's
pot
walking
on the kettle black.
I know, it's walking the line.
Wow. That's walking the line. No, that is old.
I know.
That is old parenting right there, Greg. You shamed yourself.
Yeah, but all natural.
Oh, boy. All right, back to the episode.
Right.
All right, so we on to signs and symptoms here?
Yes.
All right, thank goodness. All right, so yeah, I got a laundry list here. I'll try not to make this like too long, but there's a number of things that can be identified. The first area that the first area I'm going to look at is like social communication and interaction characteristics. So avoiding or not being able to keep eye contact, not responding to their name by 9 months of age, not showing facial expressions like happy, sad, angry, or surprised by 9 months of age. So we're getting into here what you were referring to earlier, which is like those milestones that children should be making by certain periods of time. So this is where like a parent noticing these things is really important, or like, a professional if they go into a doctor or a pediatrician or whatever. All right. So does not play simple interactive games like patty cake or by 12 months of age, uses few or no gestures by 12 months. So, I mean, the list goes on of all these different, benchmarkers for infancy, not being able to sing or dance or act for you by 60 months. Wow, that's 60 months. I never heard that reference. How old is your baby? 60 months. That seems like something no one would say.
Yeah, quite a few months.
Whoa.
Is that 5 years?
I can't wait till his first birthday. Wow. All right. So the next area is restricted or repetitive behaviors or interests. So people who have autism spectrum disorder have behaviors or interests that can seem unusual at times. They might have interests that are like hyper focused, or it might even be what I guess outside of that population might be termed as being a little bit of obsessive. Kind of that has that interest to just dig into everything, just know everything. They might have like organization, like lining up their toys or other objects, and then get upset when that order is changed. You might notice repeating words or phrases over and over. That's called echolalia. I always have a hard time saying that word. Playing with toys the same way every single time, focusing on parts of objects. So like, for example, if like he was hyper focused or the child was hyper focused on like the wheels of a car or something like that. Getting upset with minor changes, following certain routines. Another big one would be like flapping hands, rocking of the body, or spin self in circles. Has unusual reactions to the way things sound, smells, taste, look, or feel.
So he's like sort of stimming, right?
Stimming is like that, the rocking of the body. So like, ironically, I was just listening to something about Bill Gates, and I heard that when he was concentrating in meetings, he would be seen stimming, like rocking.
Glad you interesting. I also like you bring up something important too. Like I also really love when people play that Somewhere Over the Rainbow on the echolalia. I'm sorry, that's a ukulele joke. Whenever you said
echolalia. So you know what's so funny? Not funny, but like, so echolalia. Sometimes you'll see that with like repeating lines from TV shows or movies. So at my other job, working at the group home, I had this individual, this young, he was like 15, 16 when he moved in, and we didn't know too much about him, but we heard that he would like maybe they thought he was maybe seeing or hearing voices. because he was talking to himself and it sounded like he was talking to people. And one day I kind of like debunked that theory that maybe he was seeing people or, talking to imaginary people when I heard him in his room going, "You break her heart, I break your skull," or something like that. And he kept saying that line over and over. And then I'm like, I knocked on the door and I opened his door and he's watching Fast and Furious and he's literally rewinding and
Oh
saying this
God.
line over and over and over. I was like, he's not talking to
No.
people. He's just like reciting the lines from Fast and Furious.
We're family.
Yeah, he literally would say that line too, but it was so funny because I was like, is he threatening to like kill an imaginary person? But no.
So it's interesting though, because that's, a hyper-focused situation. And you notice that there is a really strong memory too, on a lot of times with.
Oh yeah, I had an individual that I worked with that literally could recite the entire Lord of the Rings movies.
Yeah.
He could put it on mute and he would be able to tell you word for word everything that was going to be said. He watched it on closed captioning until he remembered it, and that's a 3.5 hour movie or something like that.
Yeah, yeah. Wow.
I was like, "Do you even know the Hobbit movies though?" Not impressed yet. He probably knows them by now. So here's some other characteristics, and kind of lead into things I maybe already said. But delayed language skills, delayed movement skills, delayed cognitive or learning skills. They could be hyperactive, impulsive, or have unattentive behavior. Epilepsy or seizure disorder might be associated. Unusual eating and sleeping habits. I'll talk a little bit about the eating later, I think. Gastrointestinal issues, unusual mood or emotional reactions, which we'll talk more about, anxiety, stress, or excessive worry, the lack of fear or more fear than expected.
Hmm.
So it's important to note that, children who have ASD could experience all or none of these. It is a spectrum and they might experience them like fully or a lot, or they might experience them just a tiny bit because, as you said, it is a spectrum. So everybody varies. And I think that idea of a spectrum is a really hard concept for people until you really work with that population. Because when you see the different ways that when you see the uniqueness of every individual that has autism, you really truly get it. Like, some people will ask sometimes, like, "Oh, do you see any autistic characteristics?" And like the thing that they always like assuming that you're going to say is something about like eye contact. I'm trying to think of some of the really common things that people are always assuming.
Sensory stuff. They talk a lot.
Yeah. And I'm like, I work with a number of individuals who have autism that make pretty good eye contact. The thing that you have to remember is, a lot of our social skills are learned.
Mm-hmm.
And if an individual has learned that you should make good eye contact, they can successfully make eye contact. So it's
in the same way you can kind of learn a language and nuance and slang from like Babbel or Rosetta Stone. You can pick up those kinds of, oh, this is how you're communicating. It doesn't mean like you get the emotion and you get the like the social like importance there, but you can do it. You can do it on varying degrees.
So when I'm working with like an older individual, perhaps, and I'm starting to maybe tease out whether ASD is present, or maybe the individual's curious if because they feel they might be on the spectrum, or a caretaker feels they might be on the spectrum. I'm starting to look, when they're older, I'm starting to look for more nuanced characteristics versus like those really stereotypical, like commonly known because like you said, those things can be learned and adjusted. And if they were present for a long time, most likely someone else would have caught it by the time I'm seeing this individual.
And also, we haven't really mentioned anything yet, but there's also a ton of positive, and I know we're going to get into it. I haven't made a list of like super successful people with autism, but there's a ton of things that people with autism are just going to be so much better at than, a neurotypical person, if you want to use that phrase, would be. I mean, they can do things, savant level things that you couldn't even touch, right?
Yeah, absolutely. So
and you named one. You just talked about Bill Gates.
Yeah,
that's
absolutely
successful person.
So, Greg, you made reference to Asperger's earlier, and
I guess so. Yeah.
Can you explain, kind of what it is and where it is today?
So I didn't go as deep as you might think, but I know as far as Asperger's go, it was retired in 2013. And I think the reason is it's kind of a simple reason because it's so difficult to differentiate between Asperger's as a separate disorder than like very mild autism or high functioning autism. And sometimes there's this savant level intelligence, and even Asperger's itself sort of exists on a spectrum as well, right? So it's
Sure.
difficult. I mean, maybe you have more.
So the main reason it got put into the autism spectrum disorder was essentially just to allow individuals who had Asperger's easier access to supports.
Okay.
If you could, because then it's like this thing where individuals who have autism, have the supports that they need, but maybe people with Asperger's are looked at differently or more, and they just don't get the access to that same level of supports, even if it is necessary for them. So it's all about getting, being able to get access to supports, which is ultimately like the most important thing. And like the biggest thing we could ever drive home about any of this stuff is like, if you have autism or you live with someone with autism or you have a child with autism, you need to get supports in line. That's really important. There's a few differences between Asperger's and autism that are important for us to talk about, and you just referenced pretty much most of them. They typically have average to above average IQs. And this will often lend focus to areas like math, science, history, just things that are very like, I don't want to say like they're all completely black and white, but that's just like the way their brains are wired. It is really advanced, and they can figure out things that are a little bit more like, it's like that reference I made a while ago about like that engineered style brain. It's like,
Yeah,
that's kind of how they work.
Almost, and I don't want to say, I'm being delicate here too, but like without an emotion, essentially. Like it's easier to sort of really get into the nitty gritty and see things clearer if you can separate emotion from it.
Yeah. So I mean, if we were talking about emotion versus like rational brain, they'd be heavy on like the rational brain
Heavy
side,
on the
right?
rational. Yeah.
So that's with Asperger's, the average to above average IQ. For like a lot of like the that like historic version of autism that you might understand, you're looking at probably an average to below average IQ.
Mhm.
It's not obviously not for everyone with autism, but for some individuals, and I know they don't use the functioning terminology anymore, but like just for the sake of our explanation, if you're thinking about someone with like lower functioning autism, their IQ might not be as high as someone with Asperger's, who's would be considered, by that old terminology, to be higher functioning. With verbal communication.
Although that said, you might be talking to someone with Asperger's and clearly say and notice autism. You know what I'm saying? It's almost like it can be more noticeable in a sense
because of
because
the
like
spectrum.
well, yeah. Well, I mean, like because you're gonna be in a classroom or in a job setting, and you're gonna say this person's functioning at a high level, but yes, they are different. You'll know
because you're noticing the which is the part like, so verbal communication super high, but what tends to not be so high is like the social skills.
that's right.
So they have their vocabulary can their access to vocabulary can be super high. They do have like this way with words at times. And
Very
again,
very
we're making
literal.
we're
Very
making
very literal.
generalizations,
Yep.
and I know not everybody falls into these, but like with Asperger's, they can have a very complex vocabulary. But things that they're going to miss would be social cues or like body language. When somebody's not interested in carrying on this conversation anymore, or when they're not interested in the topic of the conversation,
Right.
or when they're waiting for you to end the conversation, or when they zoned out and they're not even paying attention like 10 minutes ago. Those are things that might be lost on someone with Asperger's. Like I said, again, it's hard to continue to say that over and over and not sound annoying, but this isn't going to be for everyone. But this is just kind of like, I don't know, the textbook case, I guess you would say. So day-to-day skill set, I think, is an important area to look at. because people with Asperger's, for the most part, can learn skills rather easily and they can understand the importance of most skills. Does it mean it's going to be important to them? No, but it is. They can understand that it might be important. For example, hygiene, taking care of yourself, taking care of your space. Those are skills 100% a person with Asperger's can learn. And in many ways, they might learn it significantly easier and more successfully than someone who has autism, um, and maybe is not at the same level as where this individual with Asperger's might be. They might need some support, but with that support, they can learn. Whereas a person with autism may need daily and even lifelong support to do those skills on a daily basis or at all.
And what about the skill of like empathy?
That's an emotional skill, and that might lack.
Mm-hmm.
So, can empathy be learned? It can definitely be taught, but is it felt? That's a little different. That is a really tough thing for parents.
I know.
Because a lot of times what I'll find is a parent will talk about a scenario, or they'll say like, oh, I said this to them and I tried to have them think about what it might be like for them if someone was doing this to them. And a lot of time my explanation is, I think you're trying to get them to care about things I don't know that they have the capacity to care about, or their empathy might not be there, and that might not be something that's just never there.
And that sounds uncomfortable. And we have this thought that empathy is, on one hand, it's caught, not taught. We've talked about that kind of thing before. Or maybe even a lot of people think that empathy is intrinsic. It's just kind of natural to who we are as human beings. But as we've seen with Beth Thomas and reactive attachment disorder, that's not true. It's okay to have to teach empathy and to be patient with that. And I only bring the empathy up because I think that's something that I've seen parents struggle with. My child has siblings and they don't seem to be empathetic when when they get hurt or they hurt
I can give a pretty good example. So I had an individual I'm working with, and he and a friend, he was peer pressured into throwing rocks at his neighbor's car, and she's an elderly neighbor. And I guess, they got caught, they ran away. She went over, told his mom and his grandmother. They lectured him, and it wasn't until he thought he was in trouble that he cared.
Mm-hmm.
They were like, how would you like it if somebody threw rocks at your mom's car or your grandmother, whatever. He didn't care at all. Yeah. None of that was effective. The only thing that did get to him was when he felt like he was going to now be in trouble. And then he said all the things he knew he was supposed to say. He said, I'm sorry, and all that stuff. Did he mean it for the reasons they wanted him to mean it? Probably not. And that is not something that necessarily going to be able to change. You can teach it, but you can't change it. Mm-hmm. What I do try to do with the children that I work with now is do dialectic thinking. And that's something I work kind of often on with them, getting them to see both sides of a situation. So if they come in and they have like, oh, this thing happened at school, this individual accused me of this, that's not what I was doing, and then they have a lot of anger towards that individual, I'll have them pretend that they're the other individual and describe the situation from that person's viewpoint and what they feel like they might have seen. Super hard, very difficult work for them, but when they can do it, sometimes they can really get that concept down, and then that's a nice way to later remind them of like, hey, remember that exercise we did, now put yourself in that person's shoes, and how do you think that person was experiencing it.
And in time, maybe that like empathy can be developed for sure. It's not something that's off the table.
Individuals with Asperger's, they typically don't demonstrate the speech delays that we discussed with autism. So growing up, you might not see that. And like I said, as we were saying, their vocabulary actually might be rather well and, complex. They, however, may perform that echolalia that we were talking about, kind of like reciting lines from movies and music and things like that, repeating or making they might sometimes it can just be sounds, things like that. So you might see that, but you're not typically going to see the speech delay. So Greg, some tips I just offered a couple. Do you have any tips of things that you do with some of the individuals that you work with? I have a few more, but I wanted to kind of open that up to you because I just did a lot of talking.
I'll tell you what I do and where I learn the most about autism is I talk to the parents and see what has been working for them because they pick their battles. I think that's a lot of, terminology I get. But as far as tips go, patience, acceptance, there's no one size fits all sort of treatment. So, um, and no disorder, especially autism, behaves exactly the same way for everyone. So it's difficult to, um, but I like the dialectic thinking. I like teaching, trying to practice social situations. I do that a lot with my teenage patients, right? There's often a lot of anger, often a lot of frustration. I try to joke around a little bit and see if they kind of catch on to that because I notice a lot of like a lot of the ways that teenagers get themselves into trouble sometimes is because of the very literal thinking. And one example I have is, some of the kids were getting him to. They would say, would you want to tap Miss whoever, right? And like tap, and he's like, well, I guess I would tap her, yeah. Like I don't, just thinking he meant like tap, right?
Mhm.
So, but being very literal, and of course, he says they get them to say that to the teacher, and now there's like this whole like sexual thing going on.
Yeah.
So, I mean, trying to really practice social situations, I find very important, and emotional regulation, and helping because the more you can regulate emotions, the less stimming and the less sort of
Mhm.
you're going to see. It's just you know, it's important and it's hard, and just patience, I think,
Yeah.
is the best thing.
One of the things that's really important is for individuals who think very black and white, happy and sad are understandable emotions.
Mhm.
Um, Anything in between is challenging. So when you're working with an individual, they might be able to identify someone's happy or sad, but they also might misidentify and assume someone's happy or sad or mad. And that person might actually be none of those and somewhere in between all of them. You know what I mean?
Yeah,
So,
yeah,
like, understanding and being able to, and then same goes for themselves too. They might not understand their own emotions or know how to communicate them. So understanding and communicating complex emotions is a big challenge. And some of the ways that I'll do that is like, um, I might start with just like showing different faces, different facial features, like whether it's smiley faces, like, those kind of smiley faces and making them represent different emotions, or actually looking at people's pictures of people. I'll start there usually. The other thing I stress a lot is body language and helping them learn body language and what different things might represent. Greg, for some of my younger patients and even some of the adults I work with who are who have ASD but also have intellectual disabilities.
Mhm.
One of the things that's really hard for them to pinpoint. Where do you think you notice the most when you're looking at someone's face when you're looking for emotion?
Eyes.
Eyebrows specifically. If you think about when someone's upset, think about like their eyebrows. Like
Mm.
I put a lot of emphasis on that because often when they draw faces to show emotions, sometimes if they're really struggling with the concept, they'll leave the eyebrows off, and then like if the face looks really confusing because it's like I don't really know. But when you throw them on there, it's like, oh no, I can see what
Yeah,
this
no,
person's
yeah, you're
feeling.
right there.
There,
But you're
so
trying to say that
that's
eyes aren't the window to the soul because they are.
for you,
Okay.
and that's why you make that weird eye contact with everybody.
Yeah. It's
uh,
lingering eye contact.
I heard
No,
this really cool idea too of making a scale
yeah.
and showing happy to sad. And then when an individual is struggling, maybe asking them to kind of put a mark somewhere in between those two to kind of show where they're at. So maybe they don't have the word to use.
Mhm.
Maybe they can't identify it completely, but that might be a way for them to kind of express I'm closer to sad or I'm kind of closer to happy, somewhere like that.
It's you're bringing up something interesting, right? I think that so especially with I'm going to say teenage male with autism in my experience, right? he'll say things to me like, you wore that shirt last time I saw you, or ask me a question like, is it hard being bald? Right. So like you can see that there's a lack of empathy there, but there's just something almost philosophical here. Like there's some real authenticity about that. And when you think about for people with autism, like to exist in society, it's almost like we're teaching them that you kind of have to be inauthentic.
Well, that is the dilemma,
It is,
because
isn't it?
we're teaching what you're also describing there is tact, right?
Yeah.
It's learning how, like, because some of those things are rude
Yeah.
in our society. Say, asking someone about their baldness is rude, and yes, that is kind of like an unwritten thing, and that's where individuals on the spectrum will struggle with unwritten rules, and that's our job. And the people that are caretakers of them and all the support systems job is really to help them understand those unwritten rules a little bit better. Maybe maybe not to say they're right or wrong, but they just exist. And when you
Yeah,
want,
aren't we kind of sending a weird message here when we're like, all right, let's look for the emotion on someone's face? But that maybe the what becomes uncomfortable over time is that emotion isn't necessarily true when we're trying to teach them that. Like, it just must be frustrating to feel that nobody's being real. Like,
yeah,
we're constantly wearing masks, but when they start wearing masks, we call it a symptom. It's just this. It is this. There's a philosophical thing going on there that's really kind of hard to understand, I think.
well, one of the things that I had to really struggle with recently was an individual was telling on his friends for doing things that were against the class rules,
Mhm.
but then unable to understand why his friends were mad when he told on them, because they clearly broke the class rules. So why
Right.
would they be mad? They were the ones who broke the rules. And it's like, yeah, but
Yeah. Yeah. I mean, that's a tough conversation.
it is.
Yeah.
But we know those reasons. We know how that would make someone feel, so we can
Mm.
put ourselves in other people's shoes, and that's the unwritten rules. Like, we can understand what it would be like if somebody said that exact comment to me, or they
Mm.
told on me. So that's what prevents us from doing things. We do at times, even if we don't realize we're doing it, we put ourselves in other shoes.
Right. So it's like almost like you have to draw the sad face and then you have to draw the happy face and you draw your little scale and then somewhere you have to fit in snitches get stitches.
Yeah, pretty much.
Right. So
There's
yeah,
there's
I
a
mean,
few things,
very
Greg. I
complicated.
just really quick I want to get into, though, because so some signs might be different for ASD in girls than
Mhm.
boys. One of the and I thought this was super interesting. One of the big ones is masking. So females on the spectrum might take on different types of personas in social situations, and that they feel that might be because females overall might be driven more to be social than males, and that also contributes to why girls are not diagnosed as frequently as boys.
Okay. And
And I
again, there's the masks. So learning to wear masks, they're not as easily recognized to have the disorder, maybe.
Yeah, well, and their main mission is to blend in more.
Right.
Whereas with males, and I mean, I've seen this a lot, and I can't say that this is for everyone, because like nothing is for everyone, obviously, here. But I've seen a lot more of the attitude like it's frustrating to try to fit in, or I don't know how to fit in, so what's the point?
Mhm.
Like that lack of drive to do it, and it's and like way easier attitude to just like give up and, hey, I'll just go play video games. Like, I had an individual I'm working with who was having some struggles with his peers. The girls were kind of teasing him, and then he advocated to be homeschooled because he'd rather do that. And I was like really concerned, because I'm like, this kid needs practice of socialization. But I mean, also the kids at his school were teaching him a lot of like not great things. So I think overall it might have been an okay decision. But my big concern was like, if he's not in social situations, how is he ever going to learn these things? Like, and I was role playing with him, and he was getting so frustrated
Mhm.
because I was trying to teach him like ways to kind of successfully navigate. And he's like, no, why would I do that? That's not like, that rigidness was just so strong with him.
Ton of
So,
rigidness. Yeah. And we're going to find out. So especially with it, especially complicated in the teenage age, because there's a lot going on as a teenager anyways. But I think this goal to fit in, as we'll see, with the incredibly successful people with autism, it's the wrong goal. But that whole idea is lost on a teenager anyways.
Selective mutism is another one which I wasn't really familiar with, but may suddenly become quiet in specific situations. Like maybe this person's super chatty, but then all of a sudden, like they have to go do something and they can't get the words out. Obsessive collecting is a trait that's more commonly with females on the spectrum than with males. So, like, not just I need to know all the knowledge and everything that about this thing's history, but also I need to collect everything in the realm of whatever that is. So that's an interesting one.
Yeah.
Not wanting to like hug or cuddle. That's one that I kind of thought was for both, but they're saying that is also more frequent with females. Like it's an uncomfortable sensation. And difficulty with directions and following them all the way through, which is part of like executive functioning. So those are some traits that are a little bit more common for females that could commonly get missed.
And of course, people, as they hear you say a lot of these things, they're like, this sounds like a lot of ADHD symptoms too, which is another huge developmental disorder where a lot of symptoms overlap with this.
Yeah.
And we have another episode on that if you ever want to check that out.
Yep. So I know we're going a lot into like some of like the, I don't know what you would say, the traits, the characteristics. There's a few things. So here's like, I know we want to get to the positive things, and we will, the strengths. I do want to kind of bring up some of the challenges that come up, because I think that's super important. That's typically why people want to get information about autism in the first place. If they were only having positive experiences, they would be golden. They wouldn't want to hear anything about it. So, some of the things that could cause them issues, they love routines. They can often strive on routines. Like that's routines get them through life. They build their routines. Life's good. Suddenly something comes up, interrupts the routine. Wow. That is overwhelming, right? And that could cause that individual a lot of emotional dysregulation, could cause them to, act out in numerous ways, which I'll get to in a little bit. Another trait that they may have that can be somewhat challenging is, we get this, they might have this special interest. Greg, I'm not sure if you have any like experience with this, where an individual is just like has this one thing that's like just their everything and they know everything about it.
Absolutely. Yes. Yeah. Or unfortunately, like a situation that they can't change, like a friend that they don't have anymore, like something they really get past it. Yeah, just really getting hung up on things. They're definitely uncomfortable with change.
Yeah. So I had a number of different ones. One of the ones that stands out to me, probably one of the most, because it was like one of the first experiences I had where like an individual was just like beyond what anyone has ever been like with this, but he was like obsessed with Godzilla, and he'd always talk about Godzilla, and it didn't matter if you cared about Godzilla, if you wanted to listen about Godzilla, you were listening about Godzilla. And that's, that can be challenging, because I was a paid support in this person's life. So of course I'm going to listen to Godzilla. If I didn't get paid to do that, do you think I'd be sitting around there listening to about Godzilla? Absolutely not. So I kind of think about that person in other environments and the challenges he might have had. Probably felt pretty lonely when people would just walk away or turn their back whenever he was talking about the thing he was the most passionate about.
Yeah. So I've had someone super passionate about Harry Potter, and you might think that you would get sick of hearing about that. But this person was able to go into like deep backstories about characters that you wouldn't believe, and like follow like fan fiction all the way through. So at times it was like pretty interesting.
It really can be. I mean, if depending on what the topic is, sometimes I'm really like, I get lost with them. I'm working with this guy right now, and we've been chatting every week about lost media, which I didn't even know what it was. It's like stuff about like, it's like an episode from like a TV show that never got aired, and like it's sitting in a tape in someone's office, and like there's just rumors or speculation it even exists. Like that stuff's fascinating to me, and he's just has all this knowledge, and I'm just like, keep telling me stuff, dude. Food habits, so they might get really particular, separate their food, not have very like adventurous palates, or get really routine, like I only eat this and this, and then it's a real struggle if you go somewhere and maybe those things aren't attainable, or if they're in situations with it's just different. And the other thing is difficulty in conversations. So like we said, they struggle with unwritten rules, things that are not black and white. And and it may be really easy for them to isolate due to how difficult it can be to social situations. And all these things can cause people to get overwhelmed and very anxious, which could cause challenging behaviors. So when I say challenging behaviors, some of the things I mean is like aggression, self-injury, severe tantruming. Some it's just like these meltdowns. The self-injury could include like excessive scratching or rubbing, hair pulling, hand biting, head banging, face slapping. Aggression could be, any kind of physical attack to others that are around them. And just overall this inability to have emotional regulation, like to bring themselves down. And that's something obviously we would work on with them in therapy, or hopefully there's people in their school system or at home that are working on de-escalation strategies and kind of ways to help them with that. So when you're working with someone that has challenging behaviors, one just kind of giving some pointers of how to handle that. One of the things I would always say is to like watch like if you're not sure what the reasoning for the behavior is, kind of like take notes of, we call it antecedent, is like what happened before the behavior itself, and then the consequence is like whatever happens after that. So what did they get out of that? Like sometimes it could be for some kind of like environmental response, like attention. I don't want to say attention seeking because there's a negative connotation to that. Sometimes it could be to like express something or to get some kind of need met, or it could be something totally like adjustable, like a schedule issue, or allowing someone a little bit more time to transition because maybe they're feeling rushed into a different environment and that's stressing them out. So there's so many things that go into it. So it's really important to kind of like think that way, and get a good idea of like what the function of the behavior is. And if you're a parent and you're questioning that, if you're not really sure, and you should definitely seek some support with that and try to get a few eyes on it to help you with that and come up with some good strategies that can be helpful.
I like that, Dave. ABC method.
ABC.
Yeah. Activating event, maybe instead of antecedent. I'm trying to think of a better. Antecedent's a tough one.
Right. Setting event is the other thing we say, like dinner time. We
okay.
use that. Just really quick, there's two words that I use, and I just want to explain the difference. And I didn't know that, like, really put too much thought into this. I heard this today, and I thought it was great. Meltdown versus the idea of a tantrum, because I think sometimes people think of those things as just interchangeable. So a meltdown would be, a person gets like an overload of stimuli, right? So it could be like sensory issues, it could be auditory, any outside stimuli, and it just becomes too much for the person. They have an outburst that they can't really control, and they just can't get the communication to express their emotions properly, and that could result in just like a giant outburst. Could be sobbing, crying, anger, whatever. Tantrum is more voluntary. So they didn't get a need met. They're upset about something, and then they have a voluntary action. It could look the same, could be very big, could be could involve all those dangerous behaviors I said before. But at the core of it, it's more of a voluntary reaction. Like they didn't like what happened. So, they use the tantrum to kind of express their emotion. So that's something that you might be able to calm someone down with, try to figure it out, offer support, versus a meltdown is more something involuntary and may just need some time, space, patience, and allowing that person to kind of calm before you try to like swoop in and fix the problem with them. You know what I mean? So I just thought that was an interesting little tidbit to add for people about the challenging behaviors.
Very helpful, Dave. And we all definitely appreciate your insight. You are autism. I mean, when I think of, when I'm being completely honest, I think of, because of what it's like Maslow's hammer thing, right? It's easy to see everything as a nail when my tool is, when all I have is a hammer. And then, so my life a lot of times is through the lens of mental health. And like, but I do have a middle son who sometimes I'm like, I think I want to see if I can, use my influence and see if I can get an appointment with Dave, because I see some of these things and it worries me. But at the same time, I also see so many great positive strengths that he has. But,
Mhm.
and so I think sometimes I notice myself just being a parent and getting frustrated with behaviors. And then I'm thinking, like, is this something he can't control? Is this something that, because parents probably feel a lot of guilt, right? When they
Yeah.
especially once they start to really understand that this isn't something that their kid could do, but it still frustrates the hell out of them. And that's understandable too.
Mhm.
So it's a very hard thing to navigate. Uh,
Absolutely. Yeah.
so, so should I talk a little bit about quickly about like some treatment
Sure.
and intervention? So the earlier the better. Obviously, it's helpful because you can start teaching and working on these communication and behavioral skills. But treatment can be overwhelming both for parents and the people with the disorder. So there's this thing called applied behavior analysis that it's just this approach that teaches people skills and how to use the skills that you learn, these social skills or corrective experiences that you teach people, but it's based in a motivation system. So there's some kind of it's tied to those old school forms of psychology like B.F. Skinner or classical conditioning, like an idea where you start behaving this way and now there's a reward for it. And I'm sure just like with ADHD, there's a lot of structured therapies that you can use, external reminders, and indicators, things such as that. So therapy can be very helpful, whether it be one-on-one or with the family as a group. And Dave, more often than not, I don't know if this is true for your parents, medications can be pretty useful, even though, like we said, there's no cure. So the medications
Yeah.
aren't going to treat the core symptoms, but they can kind of relieve some of the anxiety and depression
Absolutely. Yep.
and things like that.
The
But also
comorbid stuff.
sometimes,
Yep.
yeah, but also sometimes antipsychotics for extreme behavioral issues, which I don't know. That's tough, right? That's a tough one.
Not
Uh,
when you're experiencing someone with extreme behaviors.
I know. See, that's the
It's a
thing,
little
right?
different, right?
I know.
Yeah.
So it's hard to, and we talked about, I go back and forth with how I feel about medication. Anyways, other things to consider are like the medical issues that can come along with autism.
Yeah.
So we talked about epilepsy and sleep disorders and of course anxiety and depression, especially in teens. That's going to be the hardest part. Um, I just think that like those teenage years got to be really tough because transitioning from childhood to adulthood is tough enough for all of us. But I mean, with autism, it's
Yeah.
just,
Can I be honest with you though? Like
please.
a lot of the adult individuals I work with that are in residential settings, it's almost like they never left the teen phase.
Mm,
It's just as difficult for them in many ways. Trying to integrate with society and finding groups of people that they can associate with. All those things can be still super challenging for them. So, I mean, yes, definitely teen years I think are tough, but for some, it's those teen years become adult years, and sometimes those don't look any different either.
mm.
It really doesn't matter. It really plays a big part just having a supportive system around you and people really invested in helping you have like reach your full potential essentially, I think is the
Yeah.
biggest thing. And the other part of this, Greg, like just from our roles as therapists, just for people to understand kind of like why would therapy be like if it's not something that can be quote unquote cured, why would therapy be a thing that would be helpful?
Oh,
um
I mean, oh, I
so
bet you're,
many ways, but no, I was
yeah.
just going to say, like you were mentioning, like sometimes with families involved, I think one of the biggest things I can do as a therapist to support an individual, especially like a child or a teen, is giving their parents education about it, like giving them tips and strategies. As a lot of times the parents that I work with come in and I find myself sometimes talking more to the parent about actual stuff like that's problematic than the child, because a lot of times the child doesn't want to talk about stuff like like this issue that just happened at the house, but like offering the parents guidance so they can kind of understand the behavior better and they can look to make adjustments and support it more in the moment. Like I find that to be super valuable from our end, just
Oh,
to be able to give that input.
yeah. Also, it helps everyone involved to feel a little bit more validated. It helps the person suffering well, suffering, quote unquote, um, to feel validated, and the parents to say, oh, okay, like, and there's even groups, to kind of get involved and
Yeah.
talk to other parents, what's worked for them. The more, um, brains you can get on something, the better.
So, and Greg, one of the things you haven't seen me do yet when we're at our practice, just coincidentally, you haven't seen it. I often will take my individuals around the office and like have them. So we'll do like a role play in the room, and then we'll go around the office, and I will have them. We'll go up and we'll start interacting with different office staff, and which has been a lot of fun. Sometimes I like that I don't forewarn the office staff that I'm going to do it, and we just come up and I have this one guy that I'm working with right now, and it was super funny because we were making lists of what girls might want in guys because he's really interested in dating. So then I had him go up to a couple offices. We made a list of what he thought, and then I had him go up to the office staff with me, and we said, hey, do you think there's anything missing from this list of what ladies are looking for? And it was just so fun. Like, he had a lot of fun with it, but like while he's doing it, he's also coming out of his shell, and he's making good eye contact because I prepped him on what it's going to look like when we go up to the person and we ask these tough questions, and it's just a lot of fun. But just seeing them ease into these social situations and see that they're not as scary as maybe they seem in his head, like going up to somebody who he's only sort of knows as an acquaintance and having conversations is kind of fun sometimes. And that I think that's super valuable just to have those experiences with them.
Yeah, so I don't work with autism nearly as much as you do, but I do a lot of panic and OCD and anxiety, and I often do that same thing with panic disorder. Let's go talk to people.
Yeah.
You know what I mean? And see what happens. Fun. Yeah, it is. It is. Well, I mean, not at first, but it is in the end, you're right. It's the same thing. You see that you do survive it, and then you are better for it. So, where do you want to go from here, Dave? I know there's a lot of things we still want to cover, maybe a little bit of strengths, and then I like to talk a little bit of pop culture.
Yeah. So, and just quickly, like, I'm not going to go into, I was going to, but I changed my mind. Diagnosing. And that maybe, I think there is value to us considering maybe there's going to be a part 2 of this. Yeah. This is just such a broad and wide topic, and there's so much that can go in. Diagnosing and screening. Yeah, you could say that. Diagnosing and screening. But essentially, I guess the only thing I will say about that is, like, again, you're going to be looking for those milestones, and you're going to have, hopefully the physicians are going to be involved. You should be communicating with them. It's not just like someone's going to look at your child and say they have autism. There's screenings involved. There's, some testing that can be done to try to, screening. I said screening. So testing, and just ultimately it's way more formalized than just like somebody slapping on a label.
Right.
So it is something that's going to be done over time. But just it is an involvement of a team, not just like one person looking at someone and saying that. It can be a little different though with adults, because obviously they're not in schools. They're not seeing pediatricians as frequently. So it might be, somebody notices signs in an individual and kind of refers them to a healthcare provider, or you think you're starting to question it. And then, you kind of start that process with your provider. All right. So strengths. All right. I have a few here that are pretty cool. Visual hypersensitivity. So individuals with autism can have an extraordinary vision with better visual hypersensitivity, pattern recognition, and attention to details. They can often see visual details that individuals without autism don't tend to register. I heard that something about like facial recognition is like super good. I think that might have been in females with autism, if I remember correctly. Like they can remember or pick out faces in a crowd really well, or something like that. Focus of attention was found to be sharper, and sharper spatial gradient of attention was observed. I don't even know what that means. So it must be awesome.
Sounds awesome.
Essentially, they experience tunnel vision with great clarity of detail at the end of the tunnel. So that's interesting. Encyclopedic knowledge, like we already kind of know that, and that's obviously one of the things that I super appreciate is just like that ability to remember everything.
The savant level intelligence.
Yeah.
So maybe I can do this. Um, Einstein, right? Autism. Dan Aykroyd, Anthony Hopkins, Tim Burton, one of my favorites. Autism. Emily Dickinson. We've recently used that for a very important reason. Bobby Fischer, the chess player. You can see how that would make sense.
Mm-hmm.
Michelangelo. And I'm gonna say a name. You're not gonna know who this is. Satoshi Tajiri. Do you know who that is?
No.
Created Pokemon. Autistic. A
Interesting.
lot of people are gonna be thankful for that. And Elon Musk, who is worth $150 billion.
So are you sure he is, or is he diagnosed, or is he speculated?
So he was diagnosed with Asperger's prior to 2013.
Okay.
So technically he's diagnosed autism.
Yeah. All right. Because there's a few that are listed if you just look up individuals with autism that are not formally diagnosed, and people just speculate.
Yeah, no, I mean, you could definitely speculate that. I mean, I would have speculated. He's like if young Sheldon grew up.
Yeah.
The old Sheldon. Yeah, no, like this whole thing, like this is to me what I always talk about, where to stand out historically, you have to be different and you have to be outside of quote unquote normal to be extraordinary. So autistic people can be the most successful people that there are.
Absolutely.
You have to be neurodivergent to be, I don't know, incredible.
I think the thing that's like super crazy, if you
Okay.
think about it, as soon as you cross a threshold of success with like that comes with like maybe monetary value,
Okay.
nobody cares
I know.
what you have.
I know.
It's kind of crazy. Like, there's so many individuals I just wish they could see that. Like, you're just trying to be as successful as you can, and once you get there, you have so many doors open up because people stop looking at, which is like also sort of sad because you shouldn't just be looked at because you have money.
Well, I don't know if that'll ever happen for us. So
I know. So it's just a pipe dream at this point, but
yeah.
yeah. So I don't know, but you're right. It's definitely not something that has to look like a deficit, that has to look like a deterrent in life. It can give you advancement. Is if you work on certain skills, you can pretty much do anything.
Absolutely.
The biggest thing for people to understand is it really is important to, when you have a baby, when you have a newborn, watch for those milestones. The reason for it is the earlier you get intervention, the best possible outcome you are going to have.
Mm-hmm.
That's it.
And that's with everything. That's with anything, right?
Yeah.
I mean, any behavior that like you kind of don't think that's going to be maladaptive, you're going to want to take care of that as early as possible.
Yeah.
Okay. Pop culture a little bit.
Sure.
You mentioned a couple here.
Okay. So yeah, well, I mean, a couple of the obvious. I mean, Rain Man. I think that's like the one that everyone would probably know and refer to forever. I Am Sam with Sean Penn.
It's a great movie.
It's a really good
A lot of the
movie.
Beatles songs.
Mm-hmm.
Yeah.
One of my favorite shows, Love on the Spectrum.
I love it too.
It's so amazing.
Remember Michael from season 1? He's one of my favorite characters.
US season 1 or
all right. See.
US season 1?
Yeah.
Okay. Which one? What was his interest? Did he have red hair?
Mark was very interested in dinosaurs. He was in that.
Mark, that's who I was thinking of. I just loved the way he talked, and he was like so romantic. Like everything was like very like exaggerated, and yeah, they were all great. I love that show.
Yeah, it's a great show. And for me, recently, I've been into a show called Young Sheldon, and I already mentioned it a little bit. But I mean, my kids, I never watched Big Bang Theory. It's just not my thing. And when I saw previews or like whatever I saw of Young Sheldon, I was like, that's certainly not my thing either. But my kids really got into it, and so I find myself watching it with them, and I'm like, this is good. And he really, I mean, I don't know if this kid, every sort of as far as Asperger's go, young Sheldon kind of meets all the marks there. And I don't know if they did that on purpose or
Well, in Big Bang Theory, I mean, that's been some of. All right, so same with Love on the Spectrum.
yeah.
There's some people that really appreciate representation, right? But then they also, well, I guess it's. I'll start with Big Bang Theory. There's some people that feel like, oh, you're pointing your finger and laughing at it. Oh, so
You can't win with people. You know what I mean?
so, but then there's others that are like, hey, that's great to see it represented in a way that like these are likable characters. People appreciate them. I personally think, and I was never a Big Bang Theory like fan. I watch it now probably more than ever just because the rerun time
Yeah.
fits like a time I might be home. But like, I think it's cool that it made those types of individuals popular for a while.
Yeah.
Like it kind of put them on the map. Like it was cool. It's cool to be nerdy. It's cool to like NASA and space and
Yeah.
science and things like that. Like in a way, if you think about the positive things it did for that kind of culture, I guess I think that's kind of a win. And
Absolutely.
yes, you absolutely highlighted a bunch of traits of Asperger's in that sitcom. And yeah, that's kind of funny, but like life's kind of funny.
Yeah.
And individuals I work with are, you know, sometimes unintentionally funny. And that's one of the reasons why I love working with them. Some of those, but like I don't think the laughing is being done at them. It's the situations. And
Yeah, well, it's like putting it out into
matters.
pop culture and creating these like endearing personalities, and showing that, oh, I would be friends with Sheldon, old Sheldon. You know what I mean? Like this
No,
could be an intricate part of my group.
let me ask you this though. At what point though do we start actually putting individuals who are on the spectrum on the shows representing characters who are on the spectrum? Like don't like I feel like that feels like something that should probably start happening if it's not already, because at some point then it's like everything else. It's like, you know, I'm trying to think of a good example without like getting into too like you know, that kind of like territory, but I do feel like at some point we should have more representation by actors and actresses who actually are on the spectrum,
Mm.
portraying
So
characters who are on the
maybe
spectrum.
if this young Sheldon kid's not on the spectrum, he's a pretty damn good actor.
Oh, another one that I didn't even think of before is The Good Doctor
That's right.
with the kid who played in, you know, Bates Motel,
Well,
portraying
that's what you think of, and I think of what the one
he was in
Charlie
Wonka,
and the Chocolate
actually.
Factory.
Yeah,
Yeah,
Charlie.
yeah,
But again, it's another one where it's like a neurotypical actor playing portraying someone on the spectrum, and it would be
which
great
is
to
kind
see.
of, which actually, when you think about that, that's kind of uncomfortable in a way.
That's what I mean. I
Yeah,
think that aspect of
but
it is like
whatever.
I hope
I
that
mean,
can change at some point, because I
yeah.
do think that this is showing that there's value to characters.
But then where do you draw the line there? It's like, so you got a guy like a hospital patient with cancer, and you're like, couldn't you find someone with cancer to play that part?
I
It's
mean,
like,
it could probably
yeah,
leak
but
into everything.
that's the thing. Let's just do everything we can with best intentions, and let's stop being offended so much.
Yeah, I just think in general it's great to bring attention to different types of people,
Yeah,
right?
yeah,
And
if you can do it.
in lights where they can be in all these various roles. The one thing I was going to say I love on the spectrum is so I happen to really like that show, but I guess that's kind of like controversial in the field because there are people who think that it's also exploiting
Yeah,
individuals with autism in the dating realm. Because I mean, a lot of the show is very lighthearted. There's a lot of laughs at
yeah,
times because a lot of and I don't see it that way. I really love and admire how direct some of the situations can
me
be.
too.
They
And
end a
how
date.
real it is, and how
They
like authentic it
exactly.
is.
They
Like
end a date
that's
and they'll just be like, "We should just be friends," and then the other one's like, "All right, fine. Oh,
yeah.
that's fine," and then they just go on their merry way.
I
And
know,
it's
like
like I
one's like
wish.
clearly that's not what I wanted, but all right, if that's how you feel. I mean, it's very authentic, and that's what I'm saying. Like, ah, like we are the ones wearing all the masks.
Yeah. Yeah, because we're uncomfortable by everything at times. And like some of this stuff is like, no, I think it's great to see for the world to see that individuals on the spectrum are just as interested in dating as anybody else. And
Mhm.
I am here to attest for that because all the individuals I work with are wanting to date
They're
and
raring to
like
go.
they want to get out there. They're constantly, and the sad thing is a lot of the people I work with within like the agency that I work with, they end up just dating each other over and over and over, and it's because their bubble is so small. And it'd be great to see more things like Love on the Spectrum where people are putting out like, dating and, all around the state.
There should be an app for that.
Yeah, exactly. I think they are starting to develop stuff like that. So,
right. Well,
pop culture.
Pop culture. That's what we did. And, that I think, like you said, there's so much more we could talk about. But I think at this point, we'd have to kind of vie for a round two.
Absolutely.
But Dave, no, this was great. Very enlightening. Your expertise really came in handy here with all like the years of expertise that you have working with.
Well, constantly learning though. That's the thing. And I think that's the way everybody has to be. I definitely know more within the last 5 years than I knew 5 years before that. And definitely what I knew 5 years before that. So that's the other thing is just get out there, get experience and learn. Don't be afraid to work with different populations, I think is another thing that I would always say to anybody like within the realm of like our roles. If you get a patient that, on paper has autism spectrum disorder, don't shoot it down just because you're like, oh, I don't know if I can work with that individual or, oh, I'm not sure if I'm comfortable with that population. Honestly, it's quite an experience. And Greg, I know that like for you, that was new for you when you took on your first patient who had that diagnosis, right?
Yeah, it was. I've only worked with one person, and then you referred someone to me from your organization, and that's been a treat.
Yeah,
and so it's interesting and fun, and like honestly, like enriching, and that like both have added, I don't know, texture to my life, and it's you really do like you become sort of I don't know like friends.
Yeah.
I pick up some stuff like the honesty and there are times in our lives that maybe we are like we could be a little more authentic, and I learned that it's useful. Just like be authentic, even when like there's those person that you refer to me will just say something so just the way they treat you, you can know exactly where you stand, and so like if your behavior needs to be adjusted or not. Like you're getting the real. You're getting like a real mirror of your actions. Like this is what it's a great lesson in interpersonal communication, really. It's like we're trying to teach them about interpersonal communication, but we're also learning about it too.
So true.
Yeah.
That's so true. Yeah. So this was our breakdown of kind of like the basics. And I think like maybe a more advanced episode could happen down the road of maybe what some of the experiences are like for individuals who are on the spectrum. So hopefully we'll be able to do that at some point. Let us know how you feel about this episode, though. That'd be it'd be good for us to know if that is what listeners want to hear. And while you're at it, why don't you let us know about how you feel about the podcast?
Yeah.
As always, if you are so willing, we'd love a rating and review, which can usually be left on Apple Podcasts. So that would be greatly appreciated. Or you can just leave a rating on Spotify or wherever you happen to be listening. Check out our subscriber page. We have that on Buzzsprout. You can find that in our link on our social media, or if you just search up Unconventional Therapist subscription page. One more update, and I haven't even told Greg this. We have changed our email. So if listeners want to email us, you can email us now at an email that actually has our name in it, which is utgnpodcast@gmail.com. That's utgnpodcast@gmail.com. No space, no underscore, just that one phrase. Okay. Yeah, that's
good to know.
Oh, one last thing. We had a review. So Greg, you alerted me the other day that there was something on Apple. Right?
I did, yeah.
Cool. I will read that.
Okay.
Because I don't know if you were going to, so I'll do that right now. All right. So this is from Sarah Boo. The title read, "Great for work commute, 5 stars." Yeah. I gave this podcast a listen last summer, and in its absence today, realized how much this show is now part of my normal Tuesday routine and commute to work. I often find myself reacting out loud and thinking about some subjects well after the episode is over. I find that I only delay listening if it's about a book I haven't read yet. Maybe that's a heads up the week prior. That's a question. And either way, this podcast is well worth a listen and may become part of your routine too. Keep up the chipper banter, fellas.
Well, heads up, Dave. Heads up, Sarabu. Read Catcher in the Rye.
Read Catcher in the Rye.
Yeah.
Yeah, that is coming up next week.
Next week, yeah. So read it quick.
And also, she was referring to the fact that we released last week's episode on Wednesday instead of Tuesday. Apologize for that.
Sorry.
It happens.
That's
but anyways, that's not great. Anyways, thank you everyone for listening. We appreciate you. We will see you next week, and we will be talking Catcher in the Rye. So read it. Read it.
Please.
Night.